Whatever level you're at, if you're just starting off thinking I'd like to be a nurse, or whether you've been a nurse for many years, I think you'll find a team here that's welcoming of your ideas, respects your need to develop your career, supports you learning new skills, spreading your skills and developing them. So I think that what you find here is that you find a bunch of nurses who've been here for years because it's so good, and I think when people join they know why people are still here many years later.
I was a HCA for 12 years, then I did nursing obviously as a mature student, and I've been qualified 3 years now. I wanted to work with children. I've always worked with children, even pre-nursing. I worked in nurseries years ago. Wanted to progress from my HCA role, which I couldn't unless I did a nursing course, and that's to me what helped me to become a nurse.
And it was worth the change then?
Oh, definitely. It's hard work doing a nursing degree as such, but you've got to really persevere and you've got to really want to do it.
I've been qualified now for 6 months. I started on the ward after doing my postgraduate diploma at Southampton University. I've always loved working with kids, and nursing is a career that's come on a bit later in my life, as I'm a mature student. Well, I'm classified as a mature student now, and I was interested initially in adults, but children I just find so much more. They're so fun. They bounce back so quickly, and they can, they're lots of good fun to be around. It's an adventure. No day's the same. It's all very different. But the teamwork is amazing, and it's just great fun, and you learn lots. Lots of.
When I started my training, within a few months I definitely thought this is what I want to do. I do love it, and I'm glad I made the career change anyway, let's say, into children's nursing. For me, the biggest reward is, I have to say, that when children come in, they're not well, maybe they're not smiling or talking to you as much. And when they leave, they're smiling, they're happy, they've been treated, and they're just, amazing how quickly they recover, and they leave with a huge smile, and that's a reward for us. Southampton is a brilliant, vibrant place. And the hospital itself provides a lot of facilities for specialist services, and it's got a huge team to work with, and there's loads of opportunities available here, and it's a fantastic place. And the fact that you're there to make a difference to the community is fantastic.
Sometimes though we get patients that have just come up from the intensive care unit, and we get a couple of really long-term patients here who have been on the ward for up to 4 or 5 months. So it's an exciting day when they get discharged, and the whole ward normally come together because it gets to be a bit of a family here. So we all come together and celebrate their milestones and being able to go home and back with their family.
We do often see sick children here as part of the day-to-day job, and it doesn't get any easier, but you learn to cope with things differently as you progress through your training. And there's lots of people that are willing to talk to you about your experiences on the ward. And this had a really good reputation for children's nursing. I had a really good experience as a student. All the nurses were really friendly and motivating, and it made me want to be the nurse that I am today.